you should play an offensive with the examiner, not a defensive. So it is like a dangal, a wrestling competition. Now, doctor, what are you able to see here? आपको क्या दिखाई दे रहे? There is a mass and here there is a mass. So this is the appendiceal mass, appendiceal tumor. Now the question comes, doctor, appendiceal mass, one more example. Appendix से mass निकल रहा है, right? So you are able to see from the appendix there is a mass lesion. So now this is the typical histology. It is CD34 positive. So whenever you find the appendiceal tumor, examiner's question, what do you want to do? This criteria is important, doctor. Less than 2 centimeters, it is unlikely to metastasize. Treatment is simply appendectomy. If it is more than 2 centimeters, then right hemicolectomy is considered to be the treatment of choice. Now, doctor, what is this you are seeing? Cervix is not obstructed. This is the normal placenta and a normal fetus. And what do you see here? Placenta is covering the cervix, preventing a proper birth of this baby. It is very close to the internal os. That is called as placenta previa. I know that you all know that. But what is important in the tomorrow's exam? Examiner will give an image-based question where you are able to see the cervix. Nearer to the cervix, you are able to see the placenta which is implanted. So this is how on the ultrasound you will be able to identify the presence of the placenta previa is what you should remember. Fatafat bolo doctor, placenta previa is painless. 3rd trimester bleeding. Bleeding with uterine contractions can be the presentation in 20%. Ultrasound will help you. Always, what is the important principle? Don't do digital vaginal exam if you are clinically suspecting that it could be placenta previa. Otherwise, you will be initiating and triggering a massive hemorrhage is what you should remember. Now, what are the risk factors for placenta previa, doctor? Earlier previa is a risk factor. Prior cesarean or any uterine surgery is a risk factor. Multiple gestations. So that typically increases the surface area of placenta, covers more uterine surface area, leading to a larger placenta because multiple gestation, twins hai to. That will make a bigger placenta and that placenta will go and goes nearer to the internal os. Any advanced age of pregnancy also is a risk factor for placenta previa. Bhaiya, ye bolo, what is this? So this is the placenta, but there is a abnormal separation of the placenta leading to external bleeding. And what are we talking about? Abruptio placentae. Abruptio hota hai painful, previa hota hai painless. Don't remember it in a reverse way, be very sure. Now, doctor, what are you seeing here? What is this gross appearance? You are able to see fetal vessels, doctor, fetal vessels. That means this is called placenta vasa previa. What is this called? Vasa previa is what you should remember. Vasa previa is also a painless antepartum hemorrhage, but there is a rapid deterioration of the fetal heart rate. Because the source of the bleeding in the case of the vasa previa, where it is the cause of the antepartum hemorrhage, is fetal bleeding. That's what you should appreciate. Now, doctor, comes a very interesting, quick chatpata snippets. That is how we will call these flash sessions, doctor. जब भी मुझे टाइम मिलता है मैं आपके साथ बैठ के 8 to 9 फ्लैश टॉपिक्स को पकड़ के फटाफट रिवीजन करता हूं आपके साथ. Be prepared for that. So doctor, this is the renal vein के अंदर क्या है doctor? Thrombosis. Renal vein के अंदर thrombosis. Now this is another way. Tomorrow examiner is going to give you an image based question. He will give you the clinical picture and he will give you a image based question. You should be jumping and answering it as renal vein thrombosis. This is another example where you are able to see now here the renal vein thrombosis. This is the gross picture where the renal vein is showing the presence of the clot, renal vein thrombosis. अभी आ गया 5 points about renal vein thrombosis. Those who are having nephrotic syndrome, they lose the antithrombin 3 in the urine. That is the reason they have a great risk of venous and arterial thrombosis. So that is the point where you may find renal vein thrombosis. Sudden onset, there will be abdominal pain, fever, hematuria. That can be one of the presentation of the renal vein thrombosis. And any form of nephrotic syndrome, but typically when membranous glomerulonephritis leading to nephrotic syndrome, renal vein thrombosis is very common. That is what you should remember. Now डॉक्टर आप दूर से देख के फटाफट बोलना मुझे आप क्या देख रहा है? What are you seeing in this patient? Quickly, snippet means quickly we will be changing 5-6 points का ध्यान करके next topic को हम आगे बढ़ेंगे. That's how last moment revision should be फटाफट revision, right? हाँ, आपको कैसे दिख रहे हैं? His back is looking like a wall and it is looking like a dung, cow dung, buffalo dung will be there, no? If you take it and hit it to the wall, then stuck on appearance, it looks as if the cow dung is stuck to the wall. That kind of an appearance this is called as. So once more, you can see the stuck on appearance is what you should remember. This is another patient who suddenly developed multiple lesions like this. If a patient develops multiple lesions like that, what is that called? Sign of lesser trelot. What is this called? Sign of lesser trelot. When these lesions are called seborrheic keratosis. What are they called? Seborrheic keratosis. Any sudden appearance of these lesions, typically is called as sign of lesser trelot. Seborrheic keratosis is what you should remember. So it is a benign skin tumor, stuck on appearance. It is not related to sunlight exposure. That's the point. Even actinitic keratosis also have a similar look, but they are due to sun exposure, whereas these are not due to sun exposure. Any sudden appearance of multiple keratosis is called sign of lesser trelot, which is suggestive of internal malignancy if they suddenly appear. Now tell me, doctor, papular, purpuric, papular, purpuric, pink lesions. What are they? They are seen typically on the flexor surfaces. Flexor surfaces. They can even be seen on the oral mucosa. They can be seen pruritic, papular, purple lesions on the flexor surfaces. This is another classical appearance. These are going to be image-based MCQs in the tomorrow's NEET PG doctor. You should recognize. हम डर्मेटोलॉजी बहुत कम पढ़ के MBBS पास होते, एग्जामिनर हमारे साथ खेलता है. So what do you see here, doctor? Typically you are able to see a net-like, a white lacy net-like appearance. What is that called? Wickham's striae is what you are able to see. What is this called? Wickham's striae. अभी बताओ lichen planus के बारे में 5 फटाफट bullet points. Purple polygonal pruritic papules, Wickham's striae. It is lichen planus. Half of these patients with the skin lesions will also have oral striae, and typically it will spread symmetrically over a period of 1 to 4 weeks. And what is the classical finding in lichen planus, doctor? Please don't forget. This is a favorite topic of the examiner. Typically, sawtooth appearance of rete ridges. Similarly, a band like lymphocytic infiltration in the papillary dermis is a classical feature. So, what you see is damaged basal epidermal keratinocytes with the linear band-like lymphocytic infiltrate of papillary dermis at the interface with the dermis. Dermo-epidermal interface is a classical feature of lichen planus. Doctor, अभी हमारा HIV का पेशेंट आ गया. क्या देख रहे हैं आप? What is the lesion that you are able to see? A papule-like lesion. This is called bacillary angiomatosis. Typically, this kind of papule, diffuse papule-like lesions. That's what you are able to see, right, doc? So, this kind of lesions, what are they called as? Bacillary angiomatosis. Blood vessel is involved. You can see this case. You have a Norwegian scabies one side. Typically, scabies, when it becomes very diffuse in an immunocompromised individual, you call Norwegian. And there is also a papule-like lesion. This is a HIV positive individual who has developed both a Norwegian scabies and also bacillary angiomatosis. Now comes some of the 5 to 6 important points about bacillary angiomatosis. Bartonella hanseli, Bartonella quintana. It is the Bartonella which is responsible. Granuloma, pyogenic granuloma like lesions with subcutaneous nodules, liver damage, systemic impairment. These are the features of bacillary angiomatosis. Now, examiner, 2 types of questions he will ask, doctor, about HIV. Symptomatic HIV, how do you define? And what are the AIDS defining illnesses? AIDS defining illnesses. You have to be very sure. Moderate to severe cervical dysplasia, bacillary angiomatosis, peripheral neuropathy, herpes zoster, and thrush. That defines a symptomatic HIV infection. Typically it happens, that means patient did not develop AIDS, full-blown AIDS nahi aaya, but it is a symptomatic HIV infection. Whereas AIDS defining illness बोल के बोले तो क्या होता है डॉक्टर? ओरल कैंडिडियासिस नहीं, ईसोफेजियल कैंडिडियासिस, लंग में कैंडिडियासिस, ट्रिकिया में कैंडिडियासिस, not oral thrush. That is AIDS defining. Lot of times entrance exam में, lot of times, नागरेड्डी साहब गुड इवनिंग, हम बहुत खुश हैं. नागरेड्डी साहब ने बोला कि सर आप जब भी आए हम आएंगे, आप जब भी पढ़ाई करें हम भी आपके साथ पढ़ाई करेंगे. सो दिस today's December 12, 2019, this class is dedicated to Ammaji Nagreddy. Thanks for coming in spite of your busy schedule. Now doctor, AIDS defining illness, cryptococcal infection, cryptosporidiasis, Kaposi sarcoma, cerebral lymphoma, pneumocystis, cerebral toxoplasmosis, invasive cervical cancer, HIV wasting syndrome. These are all included in the AIDS defining diseases. Please don't forget. Examiner except based questions इससे पूछता है, इसलिए. Now doctor, one chatpata hot single liner MCQ. Gastric ulcer common in A group, duodenal ulcer common in the O group is what you have to remember. Then finally, before we say goodbye doctor, typically these flash sessions should not be more than half an hour. Whenever I get time, I try to run one flash session. Beta block. See, we have all these antihypertensives, no? One of the favorite question of the examiner is, other than hypertension, what are the other uses of the antihypertensives? Right? That is the favorite question. Beta blockers are also the drug of choice for essential tremor. Don't forget. Thyrotoxicosis they are used because they decrease the conversion of T4 into T3, peripheral conversion. They are used in migraine, they are used in arrhythmias. Similarly, thiazide diuretics. Thiazide diuretics retain calcium, loop diuretics lose calcium. So, osteoporosis, we use thiazides. Kidney stones, we use thiazides. Similarly, then you may get a doubt, ये क्या बात कर रहे हैं सर आप? किडनी स्टोन्स कैल्शियम की वजह से होता है ना, कैल्शियम रिटेनिंग वाला थाइजाइड डायरेटिक दिए तो कैसा सर? पूछना है. अगर आप पूछे तो ही हम बहुत खुश होते हैं डॉक्टर. पूछो. Doctor, there is one entity called hypercalciuric hypocalcemia. Hypercalciuric. मतलब in these people calcium is lost into urine. It can't be reabsorbed. So that effectively increases the calcium concentration and that leads to stones. So there you need a drug which will reabsorb the calcium so that the concentration of the calcium in the kidney will come down. So that is the whole idea. So that is the reason it is also used in kidney stone prevention in those patients whose kidney stones are because of hypercalciuric hypocalcemia. Okay, doc? Now, calcium channel blockers. They are used not only in hypertension but also Raynaud's phenomena, esophageal spasm and some arrhythmias. Finally, doctor, alpha-1 antagonists. They are used to treat the bladder outlet obstruction in benign prostatic hyperplasia and orthostatic hypotension. So that brings us to the end of this flash session, master class with Dr. Murli Bharadwaj. So I hope you all enjoyed doing a revision of almost 7 to 8 topics, 5 to 6 points about each of them within this half an hour. इसको कहते हैं evening coffee पे चर्चा. Good luck. Enjoy a nice reading, doctor. This is a beautiful winter of December. Outside, beautiful greenery. Outside the reading room. Sit with a nice boy or a nice girl. Have a nice discussion. Have a nice cup of coffee and dream big about life. Don't sit alone and go into a negative thoughts. Exam के बाद क्या होगा, कुछ भी नहीं होगा. You will remember all the questions. You will cross 210 out of 300 score easily because you have Dr. Murali Bharadwaj. Every day your classmate with you and you had been spending the last full year with Dr. Murali Bharadwaj, and tell your juniors, if at all there is only one sure shot companion who is going to be with you forever, every day, that will be Dr. Murali Bharadwaj. Ask them to join the onlineMBBS.com. Ask them to take the subscription. Our 2021 batch has already started every day, and that will be a great evening. Good luck, and see you all today night at 9 p.m. We will take the grand test discussion. Thank you.